This whole month of October, Radio 4 is going pink. And you know the reason why. ये ब्रेस्ट कैंसर अवेयरनेस मंथ है और हम भी यही कोशिश कर रहे हैं. हमने आपसे वादा भी किया था कि हम कुछ इंटरव्यूज आपके लिए लेकर आएंगे. तो टुडे आई एम इन कॉन्वर्सेशन विद डॉक्टर बिंदिया झाम, हु इज अ स्पेशलिस्ट NMC ब्लूम ऑब्स्टेट्रिक्स एंड गायनेकोलॉजी डिपार्टमेंट में, NMC रॉयल हॉस्पिटल खलीफा सिटी में. एंड डॉक्टर बिंदिया इज ऑनलाइन विद मी राइट नाउ. हाय डॉक्टर बिंदिया झाम, हाउ आर यू मैम?
Hi Faizan. Thank you very much for this opportunity. I'm very well. Thank you. How are you?
You're most welcome. I'm good as well. But there are a lot of questions in my head because ब्रेस्ट कैंसर को लेकर सबसे पहली प्रॉब्लम जो शायद लोग फेस करते हैं वो ये कि वो छुपाना चाहते हैं इस चीज को rather than come out with it. So the first question that comes to my mind is, what exactly is breast cancer and what are the chances of women suffering from it?
Okay, so basically cancer, the word cancer itself, it sounds very deadly to people.
It's very taboo as well in our culture and society.
It's a big taboo as well, exactly. So basically cancer, in simple words, means that those cells in the body which are abnormal, they're multiplying abnormally. So generally there's a certain way that the cells should multiply. But with cancer, there is no pattern to it. So अपनी मर्जी से ही cells multiply होते रहते हैं.
Okay.
And also these cells, what they do is they tend to move from their source of origin to different parts of the body, जिसे हम medically use करते हैं word metastasis. अब जो breast cancer है, breast, as we know, it's a gland on the chest wall. And breast के two main components होते हैं. One part is called the duct and the other is the lobules. So the milk that is secreted by the breast is by the lobules, and it is under the effect of two very important hormones in a female body called the estrogen and progesterone. And overall lifetime risk of a woman having breast cancer is just over 10%.
Okay.
जिससे मैं simplify करके बोलूं तो 1 out of 9 women have a lifetime risk of suffering from breast cancer.
All right.
And we also know that it is the leading cause of death in women between 35 to 55 years of age.
Oh, all right. I didn't know that.
And out of this, 15% of cases are diagnosed even before the age of 45. So I would like to tell my listeners and my women folk out there that with increasing age, there's an increased risk of having breast cancer. For example, if a woman is 20 years of age, her risk of having breast cancer at that age is 1 out of, I would say, 2100.
Okay. So that's really low. That's really low.
That is very low. Exactly.
Yeah.
That is very low. But the same woman, when she goes to the age of 60, her chances of having breast cancer is 1 out of 25. Wow. So that becomes very high, as you can see.
Yeah.
As it is a breast cancer awareness month, I would want my patients, who are rather my listeners, to take this opportunity and be more alerted to the fact about breast cancer and not take it as a taboo.
तो इसको किस तरह से डायग्नोज किया जा सकता है अर्ली? जैसे आपने कहा कि अर्ली डायग्नोज किया जा सकता है इसको. So what are the ways of diagnosing this problem?
Yeah, so the common ways to diagnose it is, first of all, be aware to certain risk factors. And those risk factors are, for example, if a woman is 40 years of age, she's at a higher risk compared to somebody who's of 20 years of age. Then the other risk factors that they need to be aware of is there any family history? Especially family history if the sister has suffered from breast cancer, or first degree relative like aunt has suffered or mother has suffered. Or if she herself had a breast cancer earlier. So they need to be alerted and they need to seek help from healthcare professionals. And the way to diagnose it is clinical breast examination to start with. So if the woman is between age of 20 and 30, then a 3-yearly periodic examination by a healthcare professional is very good.
Okay.
And for a woman who's of the age of 40, she needs to go to her doctor every year. तो हर साल उसे जाके अपना clinical breast examination करवाना चाहिए by a healthcare professional. And these are the ways to diagnose it early.
Okay.
And if the health professional obviously finds a lump or a bump in the breast, then they are going to do other investigations, जैसे कि ultrasound breast का or mammogram.
All right. So the question that comes to my mind is, can one examine herself and know that, there's a problem with me, so I should go and see a doctor?
Yes, I do encourage my patients to do it. In fact, I say 1 week after you have had your period, you should do your self-breast examination. But there is a technique to do it. And the best time to tell the technique is when they come to the healthcare professional themselves. Yes, that is the opportunity. You tell the women how to do a breast examination.
All right.
But the downside is, if some women who have dense breasts, they're heavy topped, for them, even if they're examining, they can miss out a lump.
Okay. All right.
So it's always good that, yes, do your breast examination, self-breast examination every month, but also go to a healthcare professional.
All right. Today we are in conversation with Dr. Bindiya Jhamb, जिनकी आवाज अभी आप सुन रहे हैं, who's a specialist NMC Bloom Obstetrics and Gynaecology Department, NMC Royal Hospital, Khalifa City. So we're going to talk more about breast cancer because this is the Breast Cancer Awareness Month and we promise you that we're going to bring you interviews. Radio 4 is going pink. So am I. मैं हूँ फैजान. This is Radio 4. Number 1 for hit गाने. Stay tuned.
आप सुन रहे हैं
The Weekend Jam with Faizan. 8, 9, 1 Radio 4.
बंदे के नाम फैजान. दिस इज द वीकेंड जैम. हर वीकेंड जैम पर हम बात करते हैं किसी ना किसी डॉक्टर से एंड आज हम बात कर रहे हैं स्पेशली इन द मंथ ऑफ अक्टूबर वी आर गोइंग पिंक. जैसे कि मैंने आपको पहले भी बताया था, रेडियो 4 इज has taken the responsibility to bring awareness about breast cancer specially. Dr. Bindiya Jhamb is online with me right now from NMC Bloom Obstetrics and Gynaecology Department, NMC Royal Hospital, Khalifa City से. And हमने कैंसर के बारे में बात की, किस तरह से डायग्नोज किया जा सकता है. बट डॉक्टर, माय नेक्स्ट क्वेश्चन टू यू इज कि कौन लोग ज़्यादा प्रोन है टू सफर फ्रॉम ब्रेस्ट कैंसर एंड व्हेन should they actually go and consult a doctor?
Okay, so that is a very good question because obviously the awareness women will have that yes, they are more likely to have breast cancer, they will seek advice from us. One of the common risks, even before I tell the risk factors, unfortunately what happens is that 70% of women who are diagnosed with the breast cancer, they have actually got no identifiable risk factor. But on the bright side, if the breast cancer is detected early, the survival rate is as high as 98%.
All right, that's great.
So based on this, so those women who have had a family history of breast cancer or cancer of the ovary or cancer of the colon in their first degree relatives, they are at a higher risk.
All right.
Or as I alluded to earlier, if they themselves unfortunately had a breast cancer before, those women who have started their periods early, or they stop them late. So basically, idea is that the hormones called estrogen, if they are circulating in the body of a woman in her lifetime for longer time, उनको ज़्यादा chances होते हैं breast cancer होने के.
All right.
Those women जो कि pregnancy अपनी later age में plan करती हैं, unfortunately, this is the downside that yes, they are more prone to having breast cancer. Or those who have not had any children, that puts them at a slightly increased risk.
All right.
There are some modifiable risk factors which women can help themselves with. So having, for example, less fat content in their diet. Because there's a correlation between a high fatty food and the risk of developing breast cancer. Likewise, having a sedentary lifestyle, being obese, this puts them at a higher risk of having breast cancer. So if they fall into any of these categories, it is very important that they definitely go and have a clinical breast examination by the healthcare professional.
So किस तरह से जो है ये ब्रेस्ट कैंसर की जो शिकायत होती है लोगों को, किस तरह से बचा जा सकता है उससे? Is there a thing जहाँ पर आप अपना लाइफस्टाइल चेंज करके उससे बच सकते हैं?
There is evidence to say that अगर healthy lifestyle है, जैसे plant-based products जो खाएंगे, so less fatty content, less of alcohol consumption, they are doing workouts, yes, they are optimizing their body weight. These are the things that they can work on. Obviously, that's a personal choice. वो एक lady की अपनी personal choice है at what age she wants to fall pregnant, she wants to start her family. So these become slightly tricky, but yes, there are ways where you can prevent it from happening. But अगर कोई भी जैसे breast में कोई changes आते हैं, all of a sudden, if the woman feels that there's a change in the shape of her breast, your skin over the breast is looking different, like it's looking puckered and it's dimpled, or किसी तरह की swelling या redness है, or she thinks that she can feel a lump in her breast. It is very important not to ignore any of these signs. she must approach a healthcare professional to confirm what is going on. जैसे कभी-कभी कुछ women होती हैं, and I had that in my clinic as well. They said, "Oh, it's only slight pain here, but I came to you because I was worried." I really congratulated her for that. I said, "That's very good that you are aware that breast cancer is something which we can nip it in the bud, let's put it this way." So कोई भी problem होती है, the patient should come to the doctor. That's the most important thing I would like to tell women out there.
So basically, awareness is the most important thing. This is the first step towards a healthy life overall, generally and specifically breast cancer ke case mein. There's one particular thing that you talked about in the previous link when we were talking. You talked about mammogram. So my next question is going to be about that. Stay tuned to 89.1 Radio 4, number one for Hit Gaane. Today we are in conversation with Dr. Bindiya Jhamb, who's a specialist NMC Bloom Obstetrics and Gynaecology Department se, NMC Royal Hospital Khalifa City se. Main hu Faizan, and I'm going to be right back. Stay locked.
Radio 4, number one for Hit Gaane.
आप सुन रहे हैं 8, 9, 1 Radio.
Number one for Hit Gaane.
Number 1 for cricket. Radio 4.
In conversation with Dr. Bindiya Jhamb, specialist NMC Bloom Obstetrics and Gynaecology Department, NMC Royal Hospital Khalifa City से we were talking about the awareness regarding breast cancer. तो बहुत सारी चीज़ों के बारे में बात की कि कब आपको डॉक्टर को देखना चाहिए, क्या चीज़ों से आप अवॉइड कर सकते हैं और कौन सी स्टेजेस में आप पता लगा सकते हैं. आपको अपनी फैमिली हिस्ट्री का भी ख्याल रखना चाहिए. दैट इज व्हाट डॉक्टर बिंदिया सेड. सो माय लास्ट क्वेश्चन टू यू मैम इज, आपने मैमोग्राम का जिक्र किया था, तो ये कब कराना चाहिए, किस कंडीशंस में कराना चाहिए? When should one go and get a mammogram done?
What is mammogram, firstly? Mammogram is a special type of an X-ray of the breast. And it is the most efficient way. It's a screening method for detecting breast cancer. और women को कब करवाना चाहिए? Women above the age of 40, so 40 and above. They should have this mammogram every year. And they should continue to do it for as long as they are in good health. And this is a perfect opportunity, I would like to say, is at the moment we at NMC Royal are providing free mammogram services to our patients above the age of 40. Given it is a breast cancer awareness month, I would want all my women listeners out there to come and make the most of this opportunity. As mammogram is the best screening device that we have at the moment.
All right. Thank you so much, Dr. Bindiya Jhamb. There were a lot of things that I didn't know about it. So, जो awareness की हम बात कर रहे थे, it is very, very important, and this is the reason why Radio 4 has decided to go pink, and we are celebrating this month as Breast Cancer Awareness Month, and we're going to spread all the messages across throughout the day. Thank you so very much once again, Dr. Bindiya Jhamb. It was good to talk to you.
Thank you very much. Have a nice day.
You too. Bye-bye.